What's up, guys? Nebraska is running out of nurses, 5,000 shortage. And it's the same time the state is cutting the healthcare budget. And things are getting bad. Let's dive in. Credit belongs to the owner of the videos. I'll be back with commentary.
Nebraska's short about 5,000 nurses, and systems like the University of Nebraska having to roll back their programs by $20 million. U.S. Senator Deb Fiser in Omaha to discuss these issues. And I wanted to know what more can be done so Nebraskans can get quick and affordable health care. So I took my questions to her. How are you working with groups like Methodist College or UNMC to fix this shortage and this issue so Nebraskans can get health care adequately and quickly?
Yeah, I hope to visit with the folks today and see what that is. But again, is that the federal government's job? I don't think so. Thank you.
But what exactly is their job? Fiser said it's to focus on things like national defense. She's also on the Appropriations Committee.
The problem is the federal government's not the answer for everybody's funding issues. You know, we need to make decisions at the federal level and prioritize what really is a core duty, a core responsibility.
Nebraska Methodist College CEO Deb Carlson told us they need federal funding to educate future healthcare workers because it's very expensive. They took the senator to see the kinds of equipment students are learning on, something that may be out of the realm of donations.
They don't understand how expensive that healthcare education is. So when it comes to, for example, our equipment just alone, we have $60,000 equipment up to $1 million equipment.
After her tour, a private meeting was held. I had more questions for Senator Fiser, so I waited in the lobby for her, but she declined. If I ask you some follow-ups,
when we don't have those extra layer of support, then it's going to, in the end, impact if we have healthcare providers.
Data from the Nebraska Hospital Association shows rural Nebraska is struggling. 14 out of our state's 93 counties do not have primary care physicians, and 85 rural communities are considered medically underserved for primary care. Senator Fiser said Omaha hospitals are lucky to be surrounded by groups who give large donations, and that could be a viable option for decreased federal funding.
So, guys, actually, Nebraska is facing healthcare emergency. It's not only about the number. It's real people missing care. With over 5,000 nursing positions unfilled, you can imagine how people are waiting longer. The hospital is like facing problem because of that, and of course, people are suffering because of this. And remind you, these people voted for this. They voted for this like never before. In their own policies they voted for, it's affecting them direct, which I'm not happy with that. I'm not trying to be happy because you guys are suffering, but this should be a wake-up call to know and to think before you vote, to think the consequences it will bring in your life, in your own community, in your own city. So guys, let's watching. I'll be back.
So Senator Deb Fiser recently visited Nebraska Methodist College. And in that conversation, and I'll put the link in my comments or in my description too, she was discussing the shortages of nurses in Nebraska. And of course, Nebraska has gotten a situation where they're short about 5,000 nurses. Yet they're making federal funding cuts to the colleges. And her comments, according to this interview with the Nebraska Methodist College staff, where they were trying to address that with her, her comment was, well, I don't believe that's a federal government responsibility to resolve that issue. So she's questioning the role that the government takes in whether or not they help fund programs to address our nursing shortages in the state of Nebraska. I would think that a state senator would want to figure out how we deal with the shortages of actual medical staff in a state she represents. So it's obvious her focus is on tax cuts to wealthy people and not so much to the constituents that she supports. I don't know how else to interpret that. When someone who is supposed to be our state senator says things like, well, that's not federal government's responsibility, but she's also a state representative too, she's not looking at its government's responsibility to assist shortages in key critical staff areas or key critical positions. She doesn't feel that that's a responsibility of a government to assist in figuring out how to solve that kind of a problem. That's what we have representing us here in Nebraska. And I think we really, really need to focus on getting rid of, representatives like that who do not have our best interest at heart or care about us.
So guys, let's not forget, like, Nebraska were just hurting already. Like the farmers, we saw like half of state almost were going bankrupt. We saw like hospital closing, and now this, what's happening in Nebraska, it's getting worse every day. And what's so sad is like all this, it's affecting people who live there, but also the people, they can't stop thinking like, you people voted for this, why did you do it? And other people, they are saying they thought like it's going to make Nebraska better, economy better, but they were wrong. But also, without forgetting, people warned you. But this is not the time of judging you guys. This is a time you open your eyes, you see the reality. You see, like the guy you voted for so much, he don't care that you guys are suffering. You have shortage of nurse, but he's still cutting budget. Wow. Is this what you call making America great? I don't think so. Let's watch. I'll be back.
So Nebraska, which is a red state, is still scheduled to go broke in 6 months, and the residents are very unhappy about it. And they had this to say.
So are we going to sit at home on the couch and let these billionaires control the country? Hell no. We are the poor people. We're a red state.
Now, that was a 5-minute video that I cut down to that about 10-second clip that I just showed you, because what that man said in that clip was so significant. It really, really stuck out to me. The part where he said, we're a red state, really, really stuck out to me, and further reinforces when we always say that many people who voted for this administration believed that the policies of this administration would not affect they asses. Y'all fucked around, and now it's time for y'all to find out. Y'all voted for hate, even with the possibility that you might go hungry, even with the possibility that it might affect your health. Y'all voted for hate. Congratulations on getting what you voted for.
So guys, I don't know what to say about Nebraska, because what's keeping happening in Nebraska, it's bad, especially for the people who didn't vote for this. I know, like state of Nebraska, many of you guys voted for this budget cut. All of this voted for this big beautiful bill, which is causing all this problem. But also, there's people in Nebraska, they may be few, but they didn't vote for this. I'm so sorry for those people, because you don't deserve what's happening. Other people, they just voted for this, but I think they didn't know like this one will affect them direct. They thought maybe it's going to affect other states or other people. But trust me, this guy you voted for, he don't care about you. He told you. Don't forget that. But everything he say, you just make it look like he's joking. You always have excuse for him. He lied to you. We saw how farmers suffers in Nebraska. We saw how Nebraska state were nearly bankrupt. We saw hospital closing. and we all need hospital. And now, shortage of nurses. Nurses, they are very, very important, guys. They take care of people who are sick. They follow up, because doctors, they are not like that many. It will be hard to follow, like, consistent. They have many things to do. So after the doctor check you and decide, like, nurse, take care of you, follow up until you get better. And what's happening to those people who are sick? They are in need of nurse now. What will happen? Like, there's no, because sometimes people think this policy and this one will just affect, maybe Washington. No, this is affecting people lives. And what's so sad, very, very sad, is like there's a people who are still supporting everything, who are like, okay, I'm okay with the budget cuts, I'm okay with everything. No, don't be okay when other people are suffering. I mean, people in MAGA. I saw MAGA people like, oh, I'm okay with your policy about deportation, about budget cut, healthcare, whatever. Wow. Though maybe you are okay, you're in good position, you can take yourself in a private hospital, you can afford that. But remember, there's a people who can't afford that. Also, people who voted the same way you voted. That's why I think, like, in MAGA, some of MAGA, you guys, you don't love each other, they don't support each other, they don't care about each other. Because I keep seeing things like this, because everyone is waiting for this thing to come and affect them themselves, so they can feel the pain. But when you see your own people, your own MAGA members suffering from it, you don't do anything. I can give you an example. I'm not lying about this, guys. We saw MAGA, Cuban. They are MAGA, yeah? They voted for the orange guy. They voted for him. But also, when they were suffering, getting deported, other MAGA who are not affected with that, they were chilling. We saw that, right? After that, we saw farmers who voted for him suffering. We didn't see MAGA do anything or stand up saying, like, no, this is enough, we voted for you, defend our people, we voted for. They don't care. As long as you are not affected for the moment, you are not in it. And big beautiful bill come, people were sick, and MAGA, they are turning on him. That left, and now Epstein list. So this is like, you guys, I don't know, guys, let me know what you think. This is what I think, but you're welcome to let me know what you think. I'm not attacking them, I'm just saying my perspective, what I think, what I see every day. So guys, let me know what you think. But we have few comments from the people about what's going on in Nebraska. It's something new, you may not heard from anywhere, it's just happened. So the first one said, I live in rural Nebraska and our local clinic just reduced its hours. My dad has a heart condition and now we have to drive 1 hour for checkup. This is heartbreaking. The second one said, people voted for budget cut thinking it will fix things, but now our hospital can't hire anyone. Nurses are overworked and people are paying the price. The third one, this isn't just Nebraska. This is warning for every state that think slashing healthcare is smart idea. These are real lives we are talking about. The fourth one say, I'm a nursing student and I was planning to stay in Nebraska, but now I'm applying out of state. The pay is low and the support even lower. It's not just worth it. And the fifth one is like, I used to support budget cut, but now I see my community suffering. Maybe it's time we start funding people, not just talking about saving money. Yeah, because why are you saving money while people are suffering? Who are you saving money for? That's a question people should ask themselves. So guys, let me know what you think about the situation. Subscribe to the channel. I'll see you next one. Bye.